everyone. So hope you are doing good. So coming to the last topic of IKS syllabus, that is a psychological intervention, mainly focusing on the yoga nidra and square breathing exercise. Okay. So the Sattva Vijaya Chikitsa, mind pacification for mental balance, the ancient text emphasizes the mind pacification and therapy to restore mental equilibrium by enhancing the sattva, purity and clarity, restraining the harmful impulses, and cultivating the self awareness. So these chikitsa are rooted in the Charaka Samhita and Patanjali Yoga Sutras. These interventions parallel the modern psychotherapy through cognitive restructuring, mindfulness based approaches, and systematic relaxation techniques. These ancient practices from Vedas, Upanishads, and Bihar schools of yoga represent the proactive mental health strategies that bridge traditional wisdom and evidence-based care. The three pillars of Ayurvedic therapy are spiritual therapy, mind pacification, and rational therapy. The spiritual therapy is Daivavya Prasharya, the divine interventions including mantras, rituals, and faith based on practices of psychological healing. So the Ayurvedic therapies have three pillars, which first spiritual therapy, which is focused on the chanting of mantras, rituals, and faith based practices. And the second one is mind pacification, which is Sattvavajaya, which is the conquering the mind through wisdom, restraint, and cultivation of mental clarity and emotional regulation. And the last one is rational therapy, that is Yuktivya Pracharya, is the evidence-based treatment using diet, herbs, lifestyle modification, and physical intervention. So these three are the Ayurvedic treatment methods or three pillars of Ayurvedic therapy are spiritual therapy, mind pacification, and rational therapy. So the mind pacification. The chakra describes Sattvajaya as the deliberating restraining of the senses from the triggers that provoke the rajas, that is the agitation, and tamas, that is the dullness, while fostering the sattva for optimal emotional regulation. So we had discussed earlier there are three gunas, sattva, rajas, and tamas. So when the rajas and tamas provokes and while the sattva is in optimal condition, the restraining of the senses from these three triggers to provoke these three gunas. Okay. This approach builds five essential quality to cognitive behavioral principle. So, which are they? Jnana, Vijnana, Dhairya, Smriti, Samadhi. Jnana is the wisdom or knowledge. Vijnana is the discrimination. Dhairya is the courage. Smriti, memory and mindfulness. Samadhi is the meditative absorption. So this Charaka describes the Sattvajaya as deliberating the restraining of the senses from triggering that provoke Rajas, Tamas and the Sattva. So first, moving on to the intervention, first one is the Yoga Nidra, otherwise known as Shavasana. So it is a conscious relaxation between wakefulness and the sleep. It was developed by Swami Satyananda Saraswati from Tantric and Upanishad tradition for mental catharsis and stress reduction. So, this Yoga Nidra helps to reduce anxiety, depression, post-traumatic stress disorder, that is PTSD, decreased anger, insomnia, enhancing the memory and concentration, improving the positive emotional state, and the brain, enhancing the brain alpha and theta waves. So the yoga nidra or yogic sleep induces a state of conscious relaxation position precisely between wakefulness and sleep, a liminal space where subconscious reprogramming become possible. Research evidence from randomized controlled trials demonstrated Yoga Nidra superiority over muscle relaxation for reducing depression and anxiety in health workers and validating its therapeutic efficiency. So practicing this Yoga Nidra for 30 to 45 minutes around in a day with your closed eyes will enhance your daily functioning. So let's look how this Yoga Nidra works, or the steps of Yoga Nidra, the 6 essential steps of Yoga Nidra. First one is the preparation and Sankalpa. That is, lie in the Shavasana posture and formulate and repeat the positive affirmation in, that is in the Sankalpa, 3 times with the deep intention. So firstly we need to lie down and formulate and repeat it a positive affirmation in your Sankalpa. Okay. And the second method is rotation of consciousness. So systematically move awareness through body parts, right side, left side, back, front, and release accumulative tension. So when we lie down, we will have a enormous thoughts in our mind. So we need to bring that conscious awareness into subconscious. So systematically we need to concentrate each and every body parts of our body and need to release the tension. And third one, breath awareness. So observe the natural breath at the abdomen, then practice rapid counting pattern. Inhale and exhale in reverse. Okay. Then opposite sensation is a fourth stage. Experience contrasting pairs, heaviness, lightness, cold, heat, cold, pain, pleasure to cultivate balance. So when we are contracting and relaxing the muscles in the regions of our body, we feel sometimes opposite sensation like heaviness, lightness, hot, cold, pain, pleasure. So these are very normal to experience. So we need to experience these opposite sensations. Then fifth one is visualization with Sankalpa. Engage guided imagery of serene scenes, that we need to imagine a place which gives more calm, like mountains, beaches, garden. Okay, so we need to imagine these places for our regaining that serenity. Okay. The last step is externalization and awakening. So reverse bodies can repeat the Sankalpa 3 times and gradually repeating and awareness to the external environment slowly. So basically we need to firstly lie down and we will have an enormous thought. So bring that awareness thoughts into our conscious awareness, and next we need to focus on the breathing, and next we need to uh, sense the opposite sensation. Then fifth one is visualization with the sankalpa, that serene scene, we need to visualize the serene. And last one is coming to the external awakening environment. Okay, this is the yoga nidra, which is a great exercise for relaxing um, and overcoming stress, day-to-day stress. Okay, this is the first intervention. And moving to the second intervention, which is square breathing exercise, or otherwise known as uh, box breathing. Okay, equal flow of nervous regulation. This is a method for instant relief of stress. If we are very stressed and we need to reduce the stress very instinctively, this method is very helpful. So square breathing or Vritti pranayama, equal flow, originate from Vedic pranayama tradition and calms the autonomic nervous system through balanced inhalation, retention, exhalation and suspension cycle. The ancient text linked the practices to Nadi Shodhana, channel purification for mental clarity, specifically reducing Vata induced anxiety by steadying prana. While like modern box breathing, the traditional approach enriches the practice with the multi-sensory visualization. So basically the process is very simple. We need to breathe in a square pattern. That's why it is known as box breathing. Okay, we need to inhale and hold, then exhale, then hold. This is the method. Okay, we will deeply looking into the each method, each phases of the square breathing exercise. First one is the inhale, that is puraka. That is counting up to 4 to 6 counting. Okay. In a count of 4 to 6, you need to inhale. Visualize ascending square side, engage senses with the red fire imagery and sensation of warmth. So you need to inhale firstly in a count of 4, then you need to hold your breath for a count of 4 to 6, then you need to exhale the air you take inhaled in a count of 4, and you need to hold again in a count of 4 to 6. So inhale, hold, exhale, hold. This is the method of square breathing exercise. So if a person is having very hyper panic episodes or anxiety episodes, they are not mm, they are not allowed to perform this square breathing exercise. Okay, if you are practicing this square breathing exercise, you should consult a doctor and take this square breathing exercise. This is a 4 count cycle starting with inhale, hold, exhale, hold, empty. Okay, the holistic Sattvavachaya integrating the ancient and modern approaches. So this these interventions will help in our daily routine, reduce stress, enhance our emotional state, etc. So daily yoga nidra, a 30 to 45 minutes, will consciously relaxation practices for subconscious reprogramming, and square breathing exercise to 5 to 10 minutes for Samavriti Pranayama for nervous system regulation, which enhances the nervous system and reduces the stress instantly. Then Medaya helps, which is conception of Brahmi Sankapushpa supplement for cognitive enhancement, and Shirodhara. It is an Ayurvedic treatment and oil stream treatment for deep relaxation and mental clarity. These are the ancient approaches for treatment of mental disorders. Okay, so these are the psychological interventions. There's yoga nidra, square breathing exercise, and Medhaya herbs and Shirodhara therapy. So thank you.